time to remind everyone that our Finally, residents are encouraged to visit any of the Parks and Recreation Department's 92 spray grounds. Residents are also encouraged to stay socially distanced when visiting their local site and to wear a mask when not in the water. Other measures that are still in force include home visits by special field teams, enhanced daytime outreach for people experiencing homelessness, and the city's strong recommendation to the public to safely check on older friends, relatives, and neighbors from a distance. We have to take care of each other, so please keep an eye out. You can find out more about these resources, including their locations, by visiting our website at phila.gov. Again, that's phila.gov. This oppressive heat can be dangerous, especially if you're an essential worker who must be outside on days like today, which leads me to my next topic, trash and recycling collections. We are still running 1 or 2 days behind, and we ask for your patience as crews work to catch up. All residents are asked to set out their trash 1 day behind their normal day this week. That's 1 day beyond their normal day, behind their normal day this week. The streets department is seeing 25% more trash at the curb, which means it's taking longer to collect. We're also dealing with staffing shortages due to COVID-19, which adds to our challenges. To that end, I want to thank our sanitation workers that have been pulling long hours with no days off for a long while to get caught up. They are out working in this heat, and it's not an easy job. If you see your trash collectors, please thank them and give them a bottle of water if you can. They have been working during an extremely difficult time. You can also help them by tying up your trash neatly, making sure your container has a lid, and by clearly marking your recyclables. We thank everyone for their patience, and please know that we are doing everything we can to clear the backlog to get back to normal collections. And now I'll turn it over to Dr. Farley for his update.
Thank you very much, Mayor. Since this time yesterday, we've seen a modest increase in case counts in Philadelphia, actually over the past week. So here are the numbers. Since this time yesterday, we identified 150 new cases of the coronavirus, bringing us to a total of 28,742. Now, the past week that ended last Saturday, we averaged 138 cases per day. That number could actually increase in the future with some delayed results coming in. That 138 is an increase from 110 cases per day in the week before. Now, we are doing more testing. In that past week, we averaged more than 2,500 tests per day, whereas in the past it was about 2,100 tests per day. But the percent of those tests that were positive has also increased. It was 5.5% last week, and the week before was 5.1%. And we've been between 5 and 6% since mid-June as far as the percent positive, but still the trend that there's any increase at all is concerning to us. I thought I'd give you just an update on the cluster that I talked about last week in the city's jail. Last week I reported that there was one inmate who had questionable symptoms who was tested positive, and that they tested then 64 inmates in that unit and found 23 with no symptoms who tested positive. Since that time, none of those inmates who tested positive have developed symptoms. No other inmates have developed symptoms, and no one else has tested positive. So we're hoping that that cluster is behind us. A little bit on testing. We are continuing to have problems with long delays from two laboratories, Lab Corporation and Quest, that do about 1/4 of the tests here in the city. Many of the testing sites do use those labs. We're still working on identifying other laboratories that can pick up those tests and redirecting tests to those other laboratories. More complicated than you might think. In the meantime, if people are tested, it may be a long time before they hear test results. Now, going back to the epidemic, in the region as a whole, we're seeing case counts rising. in Bucks County and in Delaware and Pennsylvania as a whole. In the U.S. as a whole, the epidemic continues to increase. We're seeing high rates throughout the South, from Florida to Texas, from the Gulf of Mexico up to around Tennessee and North Carolina. Now, it's on a little more positive note. The rise is not quite as fast as it was a couple of weeks ago. And there's at least one state, Arizona, that seems to have peaked and it's on its way down now. But overall, the message is that the epidemic is not over. The virus is still here. It may be growing here in Philadelphia. We're going to have to learn how to live with it and how to manage it. So I thought I'd take a few minutes now to step back and talk about where we are with this virus, taking the big picture. The virus has been here about 8 months on this earth. So what have we learned and what does the future look like? So in individuals, we learned that this virus causes a wide range of severity of illness, more so than any other virus that I'm aware of. Many people with infection, maybe even most, have no symptoms whatsoever. They never know that they have the infection. Of those people who know they have the infection, who have symptoms, most of them, it's very mild symptoms. However, there is a very small percentage of people who have severe symptoms or can even have a fatal infection. Now, the likelihood that someone will have a severe infection is very strongly linked to their age. People with advanced age and people with chronic medical conditions are much higher risk. Overall, in the city, about 70% of the deaths that have occurred are people over the age of 70. About 90% are people over the age of 60. Now, we know at the individual level that wearing a mask, keeping a distance from people, and having barriers and other safety precautions can be very protective if people use them consistently. Now, in the community as a whole, we've learned that if we do a complete lockdown, the virus infection rates fall. That's what we did back in March. Lockdown happened around March 17th, March 20th. And about 4 weeks later, in the middle of April, the number of virus cases per day peaked and it started to go down. There was real success there. However, that success comes at a price. Without lockdown, you also see businesses that are hurt or that fail, layoffs and furloughs of staff, surges in unemployment as a result of that, social problems, and difficulty for everybody to get things done, from basic shopping to haircuts to educating our children. And there are health consequences to those job losses too. This virus kills, but unemployment also is associated with increased mortality. So unemployment kills too, and poverty kills too. On the other hand, if we just ignore the virus and let all activity start again, we know that the virus surges and the deaths from the virus surge as well. That's what happened in Florida. That's what happened in Georgia. That's what we don't want to have happen here in Philadelphia. So what we're trying to do here in Philadelphia, across the rest of the state, across the country at this point, is to seek a balance, trying to allow some activity to occur while limiting the spread of the virus. That's what our Reopen with Care plan is about. We allow lower risk activities, and we allow, but we try to reduce the risk of medium risk activities by putting in place as many safety precautions as possible. And then we prohibit high risk activities that really can't be made safe. So for example, we allow people to walk on trails, we allow people to go to stores and shop there, but with masks and with distance and barriers and the rest of our safety precautions. But we prohibit indoor dining, and we prohibit theaters, and we prohibit large events that are inherently high risk. Let's talk about bars and restaurants for a second. Those are sites that clearly have seen the spread of the virus as well as outbreaks in other cities around the country. And in fact, they may have been the driving factor behind the major epidemics that are occurring now in the South and in the West. Now, Philadelphia did not open restaurants to indoor dining when most of the United States did and the rest of Pennsylvania did. In retrospect, I think that was the right decision. Some people have asked how we judge whether a certain activity is high risk or medium risk or low risk. But I can tell you we look at a range of factors. Any activity that involves more people has a higher risk than an activity that involves fewer people. Any activity where people are close together is higher risk than activity where people are farther apart. Any activity inside is more risky than activity outside. Any activity where the masks can't be used, such as one where people are eating or drinking, is going to be higher risk than ones where people can use masks. Any activity where people are singing or yelling or really using their voices is going to be higher risk than activity where people are quiet. And any activity when there are vulnerable people, such as elderly people or people with chronic medical conditions involved, is going to be higher risk than activity with young, healthy people. Even that's going to be higher risk than activities involving only children. So that's how we use to determine the risk of any activity. And we may not get it quite right. We try to judge the best we can, and that's what our Reopening with Care plan is about. Now, at the last press conference, I got a question about school sports that I didn't answer very clearly, so I wanted to clarify that while I'm on this question about risk of activities. The guidelines we have on our website about school sports do not prohibit competition between teams. However, we do strongly recommend against competition between teams because of the close exposure of the participants involved, and because we're also mixing people from different neighborhoods who one group may pass the virus on to another group. And so we recommend that athletic teams focus on individual skill building instead of competitions. Any activity that a sports team is involved in, whether skill building or competition, has to follow the rules, which means fewer than 50 people at one time. That includes all the participants as well as the coaches or the referees, and that there's no spectators there, so no unnecessary people involved. Now, all that's about social distancing, but remember that social distancing is only about a third of our strategy for the epidemic overall. The other two elements are containment, which involves testing, contact tracing, isolation, and quarantine, and then protecting vulnerable populations. That is trying to protect those people who are most likely to get a severe infection if they got infected with the virus at all. But no element of that strategy by itself is perfect. Each one of them is going to have some limitations to it. No element on its own can prevent the worst infection or make this epidemic go away. But all three together can keep the virus at bay and can limit the most severe infections, is what we care about the most. So what does the future look like from here? Well, if case rates rise, at some point we may need to close the medium risk activities again. I'd rather not do that, but if case rates rise, we may be forced to do that. If case rates fall, we may gradually allow these higher risk activities to resume, with close monitoring to see if that allowing those activities to resume is allowing activity to start, the viral activity to start again. If the case rates are stable, we'll stay about where we are as far as what's allowed with safety guidelines, and what's not allowed. And let's be honest, we may have cycles of opening and closing as the epidemic changes around us and as we learn more over the next few months. At all times, though, we're always going to be emphasizing the safety steps to get as much as we can around them, particularly masks, like that image you have behind me, and distance and barriers, reducing crowds, and all the other things in our 8-part safety checklist. All this we're going to have to do until we have a vaccine. Now, I understand that this isn't very satisfying. We all want the virus to just go away, or we want to have just one single thing that we can do, like more testing or more treatment that'll solve the problem. But the virus won't go away anytime soon. And in fact, it's going to take a combination of actions in order to keep this virus under control. I do think, though, if we do that, we can live with it. We've learned to go on about our lives with this virus. We can continue to learn, and we can continue to manage this. And eventually, we'll put it all behind us. More information and all of our guidance is at our website. Go to www.phila.gov/COVID. Thanks.
All right, thank you, Dr. Farley. And now we turn to Armando for the Spanish language translations of the mayor's and Dr. Farley's comments.
Palabras del alcalde Jim Kenney para el martes 21 de julio del 2020. Buenas tardes a todos. Como han notado en los últimos días, la temperatura sigue aumentando. Nuestra emergencia de salud por el calor extremo se extenderá hasta mañana a las 8 de la noche. El Departamento de Salud emitirá una actualización más tarde, hoy, con toda la información clave. Pero quiero recordarles que nuestros centros de enfriamiento ya están abiertos y que la línea de calor PCA está activa. Aunque estamos limitados en lo que podemos ofrecer debido a las restricciones del COVID-19 en curso, alentamos a los residentes a aprovechar los siguientes recursos para combatir el calor. La línea de calor PCA o PCA Heatline está operando entre las 8:30 de la mañana y la medianoche del día de hoy. Se alienta al público a llamar si tienen preguntas sobre las precauciones que pueden tomar. El número es el 215-765-9040. 215-765-9040. También hemos abierto un número limitado de bibliotecas y escuelas que tienen aire acondicionado para que las personas puedan refrescarse entre las horas pico de la calor desde la 1 de la tarde hasta las 5 de la tarde. Los visitantes deberán cumplir con las pautas de distanciamiento social y usar una mascarilla mientras estén dentro de estos establecimientos. También nos hemos asociado con SEPTA para hacer que los autobuses con aire acondicionado estén disponibles para que la gente pueda refrescarse. Las reglas normales de distanciamiento social y el uso de mascarillas estarán vigentes también en estos autobuses. Finalmente, se alienta a los residentes a visitar cualquiera de las 92 áreas con chorros de agua o spray grounds del Departamento de Parques y Recreación. Se alienta a los residentes a mantenerse socialmente distanciados cuando visiten su sitio local y a usar una mascarilla cuando no estén en el agua. Otras medidas que aún están vigentes incluyen las visitas domiciliarias por parte de equipos especiales de campo, un mayor alcance diurno para las personas sin hogar y la recomendación fuerte de la ciudad al público de monitorear de forma segura a los amigos, parientes y vecinos mayores, siempre y cuando se respeten las normas de distanciamiento social. Este calor excesivo puede ser peligroso, especialmente si usted es un trabajador esencial que debe estar afuera en días como hoy. Lo que me lleva a mi próximo tema, que es la recolección de la basura y el reciclaje. Todavía estamos atrasados 1 o 2 días y le pedimos su paciencia mientras los equipos trabajan para ponerse al día. Se les pide a todos los residentes que depositen su basura un día después de su día normal de recojo esta semana. El Departamento de Calles está viendo un 25% más de basura en las aceras, lo que significa que les toma más tiempo el recolectarla. También estamos lidiando con la escasez de personal debido al COVID-19, que se suma a estos desafíos. Quiero agradecer a nuestros trabajadores de saneamiento que han estado trabajando largas horas, sin días libres, para proporcionar este servicio. Están trabajando en este calor y esto no es un trabajo fácil. Si ves a tus recolectores de basura, agradéceles y dales una botella de agua helada si es que puedes. Han estado trabajando durante un momento extremadamente difícil. También puedes ayudarlos atando tu basura cuidadosamente, asegurándote de que su recipiente tenga tapa y marcando claramente lo que son los artículos reciclables. Agradecemos a todos por su paciencia y sepan, por favor, que estamos haciendo todo lo posible para evitar los retrasos y volver a los horarios de recolección normales. Y esta es la actualización en materia de salud para el día martes 21 de julio del 2020. Hemos visto un aumento moderado de los casos en Filadelfia durante la semana pasada. Para el día de hoy reportamos 150 nuevos casos con un total de 28.742 casos acumulados. En promedio, hemos tenido 138 casos diarios durante la última semana. Esto ha representado un aumento con respecto a la última medición, 110 casos en promedio diario. Estamos realizando más pruebas y el promedio es de 2.500 pruebas diarias. Aproximadamente el 5,5% del total de pruebas realizadas han dado resultados positivos. La semana pasada, esta cifra era del 5,1%. Desde mediados de junio, el porcentaje de casos positivos se ha mantenido entre el 5 al 6%. La semana pasada reportamos 23 casos positivos en las cárceles de las 64 pruebas realizadas. Ninguna de estas personas desarrolló síntomas y no ha habido más casos desde el último informe. Tampoco ha habido brotes de la COVID-19 en los hogares de ancianos y en otros entornos congregados. Respecto a las pruebas, continúan los problemas debido a los retrasos de los 2 laboratorios más grandes. Muchos centros de prueba utilizan esos laboratorios y el 25% de todas las pruebas les son enviadas. Estamos trabajando para redireccionar todas las pruebas a otros laboratorios. Hoy, lamentablemente, reportamos un nuevo fallecimiento por el COVID-19 en la ciudad. El total acumulado de muertes por la COVID-19 es de 1.666 fallecimientos. En las últimas 2 semanas, el promedio de muertes fue de 1 a 2 muertes diarias. 854 de estas muertes se registraron en hogares de ancianos y representan un 51% del total de muertes. En la región, los casos continúan avanzando y aumentando en los condados de Bucks, Delaware, y se encuentran estables en el condado de Montgomery. Retomando el tema de la evolución de la pandemia en los Estados Unidos, vemos que los casos se están incrementando rápidamente. Hay una alta tasa de contagios en la Florida, en Texas, en Tennessee y en Carolina del Norte. Sin embargo, en este momento el aumento de los casos no es tan rápido como lo era hace 2 semanas. Arizona ya está viendo descensos en el número de casos desde la semana pasada. Nuestro mensaje es el siguiente. La pandemia no ha terminado. El virus todavía está aquí entre nosotros y tendremos que vivir con él. Hemos vivido con el virus aproximadamente ya 8 meses. ¿Qué es lo que hemos aprendido? ¿Cuál será el futuro? Para los individuos, este virus causa un amplio rango de enfermedades severas. Muchos no presentan síntomas o presentan síntomas moderados. Hay un pequeño porcentaje que desarrolla síntomas severos o fatales. Muchos de estos síntomas están asociados con la edad avanzada y con la preexistencia de condiciones crónicas. El 70% de las muertes son entre los mayores de 70 años y el 90% entre los menores de 60 años. El usar las mascarillas o tapabocas al salir de casa, mantener la distancia social, usar barreras en los comercios, pueden ser medidas que ayuden a mitigar el virus, si es que las personas las aplican de forma congruente todo el tiempo. En las comunidades, si hay un cierre completo, las tasas de infección del virus disminuyen. Tomó 4 semanas desde mediados de marzo a mediados de abril para que aplanemos la curva. Este éxito, lamentablemente, tuvo un precio. Muchos negocios sufrieron o tuvieron que ser cerrados. Hubo despidos o suspensión temporal de los trabajadores, un aumento en el desempleo y los consiguientes problemas sociales. La dificultad para hacer las tareas diarias, desde comprar alimentos a recortarse el cabello o hasta proporcionarle una educación a nuestros niños. Y las consecuencias de salud que se relacionan con la pérdida del trabajo. El virus mata, pero la pobreza y el desempleo también matan. Si permitimos todas las actividades, el virus va a repuntar y como consecuencia las muertes por el COVID-19 subirán también. Miremos los ejemplos que nos han dejado Florida y Georgia. Estamos buscando un balance ideal que nos permita que se reanuden ciertas actividades a través del plan de reapertura con cautela. Se permitió el reinicio de actividades de bajo riesgo, tratando de reducir todos los riesgos, aplicando medidas de precaución y seguridad. Se prohibieron actividades que no podían hacerse de forma segura. Algunos ejemplos de estas medidas fueron el que las personas pueden hacer deporte al aire libre. Las personas pueden ir a las tiendas, pero usando mascarillas y respetando la distancia personal. Se prohíbe el servicio de comidas en el interior de restaurantes, teatros y eventos masivos. Respecto a los bares y restaurantes, ha habido brotes de la COVID-19 en otras ciudades. Abrir estos establecimientos en muchos casos ha sido un factor determinante en el crecimiento de los contagios en el sur y en el oeste del país. Filadelfia no permitió su reapertura cuando muchas partes de los Estados Unidos y el resto de Pensilvania sí lo hicieron. En retrospectiva, esta fue la mejor decisión que tomamos. ¿Cómo medimos el riesgo de las actividades? La cantidad de personas involucradas. ¿Se puede mantener la distancia social? ¿Son estas actividades al aire libre o bajo techo? ¿Pueden usarse las mascarillas todo el tiempo? ¿Hay presencia de grupos vulnerables entre los jóvenes y los niños? Esos son algunos de nuestros criterios que tal vez no sean perfectos, pero lo hacemos de la mejor forma posible para controlar el índice de contagios en nuestra ciudad. Quisiera proporcionar una aclaratoria sobre los deportes escolares. Las directrices no los prohíben, pero nosotros no los recomendamos debido al riesgo que estos involucran por su exposición cercana. Recomendamos trabajar las habilidades grupalmente. Los equipos deben observar las normas, es decir, menos de 50 personas en el campo y no se acepta la presencia de espectadores. Recuerde que la distancia social es solamente un tercio de nuestra estrategia. Los otros 2 elementos son la contención del virus, a través de la disponibilidad de pruebas, el rastreo de contagios, el aislamiento y la cuarentena, la protección de poblaciones vulnerables. Ningún elemento es perfecto por sí solo, pero en conjunto pueden prevenir la propagación del virus. Respecto a nuestro futuro, si es que los casos aumentan, en algún momento deberemos considerar el clausurar las actividades de riesgo medio. Si los casos descienden, se permitiría gradualmente las actividades de alto riesgo con un monitoreo cercano. Si es que los casos continúan estables, seguiremos donde nos encontramos actualmente. La evolución de los ciclos del virus nos ha permitido aprender más de su comportamiento. En todo momento, enfatizamos el protocolo de seguridad, el uso de las mascarillas o cubrebocas, la distancia social y la instalación de barreras de plexiglas en los comercios. Tenemos que acostumbrarnos a todo esto hasta que tengamos una vacuna disponible. Todos queremos que el virus se vaya o tener una simple acción o tratamiento que resuelva este problema, pero el virus no se irá pronto. Tomará un tiempo y todo dependerá de una combinación de factores. Y es posible vivir con el virus. Hemos aprendido cómo desenvolvernos adecuadamente con el virus a nuestro alrededor y continuaremos aprendiendo para poder manejar mejor esta crisis. Eventualmente dejaremos esto atrás. Recuerden usar la mascarilla, mantener la distancia social y observar las normas y las pautas que dictemos de tiempo en tiempo. Juntos podremos superar esta tormenta. Muchas gracias.
All right, thank you, Armando. We are now going to move to the Q&A portion for members of the media. We are going to start with questions on topics related to the COVID-19 pandemic or other related matters, including the heat health emergency. If time permits later, we will open the floor to other topics. So if your hand is raised now for another topic, please lower it and we will do our best to get to it later. I also want to mention that we are joined today by Derek Ziegler, who is Deputy Director for Planning in the Office of Emergency Management. And he is here in case there are any further questions regarding the operational aspects of cooling centers and other aspects of our response to the heat health emergency. As usual, we have limited time during the briefings. Only one representative from each media outlet is permitted to ask questions in the first round, and we ask that you limit your questions to 3 or fewer. Let's start off today with Mitch Blocker of NBC 10.
Good afternoon. Dr. Farley, you have said that there are enough testing supplies in order to test the 5,000 people per day that you would ultimately like to see. I'm curious, why isn't there enough demand to hit that 5,000 test number right now?
Well, I'm not entirely sure. If people don't feel sick, they may, don't necessarily feel obligated to go in and get tests. And maybe if they're mildly ill, they have mild respiratory symptoms, they may not feel that there's a need to do the effort. We are working on media messaging about the need to be tested. We don't think that people who have no symptoms should go in and get tested, but we certainly want people who have any symptoms at all, or people who have been exposed to someone, to be tested. So we do want to encourage testing in the right folks.
Do you think these delays in testing results contribute to more COVID infections in any way?
They may be. Fortunately, it's only a quarter of our tests that have they use these labs that are so long. But certainly, if somebody is tested positive and doesn't know it, they're probably more likely to expose other people, and then they may not be aware of it. So it's certainly it is a problem. It's a national problem because these labs serve the entire country. It is hurting the overall response.
And finally, I don't know that this is a question for you, Dr. Farley, but I'm curious how COVID-19 has affected the city's ability to pick up trash. The mayor had mentioned that there were some staffing shortages. Could somebody please address that?
Yeah, I mean, we our sanitation workers are working very hard every day, 6 days a week, sometimes 7 days a week. It's extremely hot. A number of them have been affected by the virus. There's a lot more trash that's being produced because people are staying home. Probably 25% more trash than we're used to. We've had 2 major storms, which caused a blip in our ability to deliver service. We're about 2 days behind now. We've relocated some of other department workers that would work on other things like highways and the like to supplement the sanitation pickup, and we're catching up and getting back. I mean, it's all of the factors. It's the weather factors, the heat factors, the COVID factors, the additional trash factors that have all come together to slow us down. But people are working hard, and we'll get back to normal shortly.
Real quick follow-up question, sir. Have they had any testing delays? Are they quarantining while they're waiting for their tests? Is that one of the reasons they're not able to get out and pick up trash?
I can't give you a direct answer on that. I don't know if Dr. Farley knows, but I know that one facility in Northeast Philadelphia has been impacted heavily, and we're moving people to supplement those workers being not available.
Yeah,
Okay,
I don't have
thank you.
numbers. I would simply say if we had a worker who tested positive and was working with other workers, then those other workers would have to quarantine, and so that would reduce the number of people on the trucks.
Thank you.
All right, thank you, Mitch. Let's go now to Max Marin of Philly Penn.
All right, Dr. Farley, this question is for you. The city still considers people who are experiencing one symptom of the coronavirus, regardless of which symptom, to be symptomatic. Is that correct?
Yes.
Okay, so and I'm curious about the outbreak and the cluster that you said has been resolved in the Philadelphia Department of Prisons.
Right.
I spoke with some people there who said that among those folks who tested positive and were asymptomatic, that they indeed had some symptoms, but maybe just perhaps 1 or 2 of the symptoms, the possible range of symptoms. Do you have any more information about those asymptomatic individuals? Why they might not have been counted as symptomatic?
I don't. I simply have the information that I'm getting from the medical team at the jail. They classify people as symptomatic, asymptomatic. I don't have any more details than that.
Brian Abernathy, do you have any details? Brian on the line?
Yeah, I'm here, Max. I don't have any additional details as how they're classified asymptomatic or symptomatic. Certainly, anyone that's been tested has been quarantined appropriately, and I think the prisons has done a decent job of stopping the spread of the disease.
My question is more regarding just whether the numbers are accurate in terms of how we're counting symptomatic and asymptomatic individuals.
Sure.
Do you think that that's accurate?
I think it's accurate from the information that Dr. Farley and I have been relayed. We'll certainly circle back with the medical team at the prisons and make sure that there's no misunderstandings or mistakes in the data that we're providing.
All right, I'll follow up with you.
Thanks.
Thank you.
All right, thank you, Max. Let's go to Julie Hansher of Green Philly. Julie, you're up.
Hi, thanks. I know you said due to the pandemic, sanitation workers and collections have been strained. Residents have been seeing trash and recycling going into the same truck. Why is this happening?
It's probably an effort to catch up with the volume that we're dealing with.
But does that mean then that all of the materials collected would be going to be incinerated, or what would be happening to those materials?
I'm not sure where it's disposed of, but we are in a crisis mode with severe heat and severe weather and shortages of staff. People complaining they want their trash picked up, as they rightfully should. And we're doing our best under terrible circumstances.
Okay, another question. Do you know how much of the city's sanitation collection is combining the trash and recycling?
The other issue before we go there is that I'm being told that because of the storms, the recycling, a lot of the recycling cardboard was contaminated with the water, which made it not recyclable. I'm not a recycling expert, but that's what I'm being told.
Okay, do you know how much of the collection would be combining trash and recycling?
I have no idea.
Okay, thank you.
All right, thank you, Julie. And we will go now to Jack Thompson of Metro.
Hello. This is about the outbreak at the jail. I've been told by some of the people there that those who tested positive were moved to a closed facility, the alternative and special detention central unit. From what these people were telling me, the space was not prepared to be occupied. They said it had mold, asbestos, lead, no air conditioning, no cameras or sprinklers, and related issues. Can you speak a little bit about the conditions at the facility that the prisoners who tested positive were moved to?
Sure. So the ASD unit is the quarantine unit. It's it was actually in operations up until just a few months ago. It has certainly been certified and was prepared to be operationalized. None of our facilities, except for CFCF, have air conditioning, so that is not a new challenge to the prisons. But certainly have every confidence that that unit was prepared to be open and the conditions were appropriate.
Yeah, and one other question about that. The inmate was saying that he could not contact his attorney because the secure lines are not set up at the ASD. Is that true, or can inmates there have unrecorded conversations with their attorneys?
Inmates should be able to have unrecorded conversations. We'll certainly confirm that there wasn't any misunderstanding or miscommunication, but absolutely, attorneys should be able to be contacted. There were limitations on some contact during the lockdown, during the initial quarantine. I think we were able to make adjustments in order to alleviate those concerns, but certainly not because of the facility itself.
All right. Thank you.
Thank you, Jack. Let's go to Chad Perdelli of 6ABC. Chad, let me try unmuting you again. Are you there?
You got me?
Go for it. You're up.
Yeah, this question is for Dr. Farley. Dr. Farley, some people say there are still disparities between testing for minorities and those in the white community, and that people of color are waiting longer to get tested, and it's much more difficult for them given the hours of the sites and so forth. Do you think the city's done enough, and what's your position on what you guys have done and to support that?
Yeah, we certainly want to make sure that we have adequate access to testing for the populations that are more affected. So African Americans are more affected, Latinos are more affected. However, our numbers so far look like we have reached them. We have numbers on our website, and I think that we have about twice as many African Americans as whites who were tested so far. Latinos, maybe a little less, maybe more average as far as on a population rate basis. We can always do better. We're particularly interested in people who are may not have that much money, may not have insurance, may not have cars. We're trying to improve our access to testing through contracts with a number of organizations. We'll set up additional testing sites. But so I think so far we've done fairly well in trying to make access available with the resources we have overall.
Dr. Ayla Stanford with the Black Doctors COVID-19 Consortium says that, she thinks there's a reluctance for people of color to come to some of those testing sites in this city. Do you think the city needs to do a better job, and how difficult is it for the city to maybe get more people of color, nurses, doctors that could maybe administer those tests and maybe get the word out that it's okay, you can go to these sites? Do you think there may need to be a better PR campaign?
Well, I do think we need to do more, and the more things that we are doing is, number one, we're putting out contracts with other organizations to do more testing. Dr. Stanford's organization is one, but there are others as well that are getting contracts to set up additional test sites. And we are working on a media campaign to encourage people to get tested. And certainly that media campaign is going to be focused on the folks who are greatest risk, where it's going to be African Americans and Latinos and people with minorities in general.
Are these still just COVID questions right now?
Yes, they are. And so I will let you guys know in the chat when we're at the end of the first round. And if there's time, we'll go to other topics. For you, Chad, we will go to Liz Tung of WHYY.
Hi, yeah, I have a question related to the heat emergency for Dr. Farley or whoever's best equipped to answer it. So there are 10 cooling centers in the city, but none of them is in South Philly. The city's heat vulnerability index has identified areas in South Philly as high priority areas for intervention. So how did the city determine the location of the 10 cooling centers?
Doc, do you know?
I think Derek is going to answer that.
Yes. So, so we looked closely, recognizing that we have limited resources at what sites made sense. Certainly not a perfect solution, but we looked at areas that had high heat vulnerability, maybe didn't have access to spray grounds, and kind of balancing where the facilities we were able to get open at the libraries and the schools were. So recognizing it's not a perfect solution. And I will say the cooling centers are only one part of the overall approach, as the mayor alluded to, using the heat line from PCA, checking on friends and neighbors. Those are all actions that we would recommend regardless of the situation.
Liz, let me unmute you. Were you finished?
Yeah, that's it. Thanks.
Okay, very good. Thank you, Derek, and thank you, Liz. Let's go now to Argenis Figueroa of Univision.
Yeah, good afternoon. You hear me? Yeah, okay. Buenas tardes, Armando. Armando, mi pregunta será para el alcalde Kenny o el doctor Farley. Y te pongo un poco en contexto. Es que la Asociación de Bodegueros de Filadelfia, esto es en el norte, nos ha denunciado que hay personas que no están acatando la orden mandatoria de usar mascarillas. Y esto, además de ser un foco de propagación, les trae a ellos multas para sus negocios. Entonces, ¿qué acciones podrían tomar estos dueños de negocios y cuáles tomaría la ciudad si esta acción se hace más frecuente?
Bien. The question is for either Dr. Farley or for Mayor Kenny. This is in regards to the Association of Bodega Owners in the Northeast that have reported that their customers are not complying with the order of wearing the masks. And this is, in addition to being a focus of propagation, results in fines for those business owners. And what can they do in order to get this accomplished and avoid these fines?
I didn't hear the first part of the question. Who's violating the mask provision?
Their customers at bodegas and shops are not complying with orders to wear the masks, and the business owners are getting fined for it. What can they do in this regard?
I can answer that, Mayor. So we are not fining any business owners for not enforcing the mask rule, not that I'm aware of. If there is any instance of that, please let me know, but I don't think that that's part of our plan. We are asking the business owners to enforce that rule. Most important thing for them to do is to put up a sign that say masks required. We have been passing out those signs at businesses all over the city and then reminding that of their customers. That we do think is gradually working. It may not be 100%, but we're making progress on that. And again, if there's anybody that says that they were fine by this, please let me know.
No tengo conocimiento de que hayan recibido multas los propietarios de negocios porque tus clientes no estén cumpliendo con la orden de utilizar las mascarillas. Lo único que les hemos estado pidiendo a los propietarios de negocios y los comercios es que hagan cumplir con esta regla y que pongan un letrero que indique claramente que se requiere el uso de mascarillas para poder obtener servicio en sus comercios. Nosotros les hemos estado distribuyendo estos letreros. Nosotros queremos que les recomienden y les recuerden a sus clientes y obviamente no va a haber un cumplimiento del 100% en ello. Pero si están conscientes de que ha habido alguna multa, por favor déjenme saber.
Okay, perfecto. Otra pregunta, Armando, es para el doctor Farley, es que aún existen ciertas dudas sobre el uso de las mascarillas y algunos padres dicen que no enviarían a sus hijos a la escuela ni a otras actividades físicas porque creen que el uso de tapabocas los puede asfixiar o ocasionarle daños. Entonces quisiera que nos diera su recomendación a estos padres ante la duda.
Gracias, Argenis. This question is for Dr. Farley. Dr. Farley, amongst the general public, there are still some doubts as to the use of the masks, and some of the parents are saying that they will not send their kids to school or to in-person activities if they have to wear the mask due to probable complications and damages to their bodies that could lead to asphyxia. What can you tell those parents that have those ideas about the use of masks?
The masks are completely safe. They're not going to cause harm to anybody, and it's going to be much more dangerous if their children do not wear a mask. Dangerous to the children and dangerous to the people that are around that children. So I think this is probably more just that people aren't accustomed to the mask than they are than there's any real risk to the mask. So at this time, we just can't get the message out there consistently enough. Wear a mask when you're around other people. We're going to have to be in that circumstance until we have a vaccine.
Okay. Básicamente, Argenis, la respuesta es que el uso de las mascarillas es algo seguro y no causa ningún daño y para nadie y que es mucho más peligroso el no usarlas, es peligroso para los niños mismos y es peligroso para las personas mayores con quienes estos niños están en contacto. Tal vez sea un tema de que la gente no está acostumbrada a utilizarlas, pero realmente no hay un riesgo el utilizar las mascarillas y nosotros estamos haciendo lo posible para transmitir este mensaje y concientizar a la gente. Tienen que utilizar las mascarillas hasta que tengamos al menos una vacuna en el horizonte.
Perfecto, muchas gracias, Armando.
Por nada, mucho gusto.
Thank you, Argenis and Armando and Dr. Farley. We will go now to Pat Loeb of KYW.
Hi, Dr. Farley. The CDC put out some data from antibody testing that it did in the general population in several cities. And in Philadelphia metro area, 3.6% had antibodies in May, which according to them means 7 times as many people have the virus as have been identified through testing. Are you familiar with this study? Do you have any further context about the implications for the metro area?
No, I haven't seen that data, and I'm very interested in seeing it. I'm surprised that I haven't heard about it. I need to check up on it. I'm not at all surprised that there would be many people who would have antibodies that would have no recollection of having been infected because many people have this infection without any symptoms. If anything, I would have expected our percent with antibodies would be higher than that. So I'll look at that, and I think actually at this point, the higher it is, the better off we are because that means more people are likely to be protected against future infection.
Thank you.
Matt, are you all set? Yep. Okay, let's go to Manny Smith of CBS 3.
Hey, a couple of questions. I wanted to clarify real quick. During your update, Dr. Farley, you mentioned rising cases in Bucks and Delaware. Do you mean Delaware County or Delaware as in the state?
I mean Delaware County. I'm sorry if I wasn't clear.
All right, so rising cases in Bucks and Delaware. All right, cool. And then, and no particular number or like to quantify that. Can you say that at this point, or?
I'm sorry, I had trouble hearing you. Say it again.
Can you quantify what the rise was in those 2 counties that has you concerned? Is there a percentage?
I don't have the exact numbers, but there is a graph that comes out on a daily basis that we see from the state where I can see the trends in the surrounding counties, and I'm speaking from that graph, not from a specific number.
Got you. In general, I know you gave us some your broader concerns, but in the short term, what are your concerns mostly in the next few weeks with this rise in numbers? Is there something we should be looking out for, or something more than masks wearing we should be doing to prevent a rise?
Well, mask wearing is the most important thing, but then all these other safety guidelines. And I'd say all of us need to follow the trends in those case counts and the percent that are positive. The rest of the country is rising, the rest of the state is rising. I would be surprised if we don't continue to rise. If it rises and falls, then we're doing fine. If it continues to rise, then we're going to have to look at whether we want to have additional restrictions.
And at this point, are you still confident in rolling out the Philly School District reopening plan with the rise in cases already before we've got additional motion of students, teachers, and parents going back to school?
At this point, I still think it's appropriate, but it's something we're going to have to continue to watch. This virus changes all the time, and so our approach to it has to change as well.
All right, thank you.
Thank you, Manny. And we will go now to Sean Walsh of the Inquirer.
Thanks very much. Mayor, you mentioned the delays in picking up trash. There is debate about why so many workers have called out sick, if all of them were sick or exposed, or if they're calling out sick to make a point to the city. And I was wondering if you could weigh in on what your perception of why they're calling out sick is.
I mean, if they're calling in sick, I'm taking them at their word that they're calling in sick. There have been people exposed to the virus and contracting the virus. And some people are working 6-7 days a week, 12, 14-hour shifts. And whether that's an illness or an exhaustion, I don't know. And I'm not the one who judge, to judge. They've been working hard, and we're supplementing the workforce when attendance falls off. I don't think there's any message to the city, frankly.
Okay, thanks. And on that topic, Brian, you previously said that when we were talking about police officers, that the reason you would change, it's possible that the city would change its stance on not releasing the number of city employees who have contracted the virus if it affected city operations. Since that seems to be the case with sanitation, are you able now to say how many sanitation workers have tested positive?
Certainly willing to discuss that, but not at this time. So we'll certainly circle back, Sean, and give you a better answer.
Okay, fair enough. And lastly, Dr. Farley, with the increase that has happened, or just with new cases recently, is there a strong link to people who have traveled elsewhere, or is a lot of this happening just spreading within the city?
Well, we ask people if they've traveled, and certainly some have, but it's really hard to say whether they were bringing infection with them or whether they got infected here. I'm guessing that the majority of infections occurred from exposures here in the city.
Okay, thank you.
All right, thank you, Sean. We'll go now to the last of the first round, Corey Clark of PCN.
Hi, Dr. Farley. Thanks for clarifying the interscholastic sports in the beginning, but I just want to nail down, you said the competition, the amount of competitors would be limited to 50.
Correct.
So
an amount of people total, that includes the competitors as well as the coaches.
Coaches, officials. So does that basically mean something like football or soccer won't be allowed?
You who know more about sports than me can tell me whether you can have a football game with 50.
An average roster of one football team is probably more than 50. So
if they were to do that, they might have to have a smaller roster if they wanted to do that. Now, again, I want to emphasize, we're not recommending the competition. We're recommending instead they do skill building, but it's not prohibiting it. Clearly, if it takes place within those guidelines, it's going to be a very different sort of game.
So any game has to have less than 50 people total in the participant.
Correct.
Okay, so I think coaches should probably take note of that. And have you been in contact with PIAA District 12, like for the city?
I have not had any conversation with them, no.
Okay, and just one other thing with the schools, with the reopening, is there a protocol in place for what if a student or a teacher were to test positive?
There is. I'm not sure how much is details been written down, but certainly we've had the school's planning around that. We are planning around that to do contact tracing and put give instructions for the proper people to quarantine who have been exposed.
And one last follow up. So is there any chance of any of this changing, like the 50 participant number being relaxed between now and football or soccer season?
There's always the possibility that any of this could change. As the virus could get worse, things could get better. What I can tell you is where we are right now. And I know that's frustrating. People wanted to be able to predict what's going to be like in 2 months, but we just don't know.
Thank you.
All right. Thank you, Corey. We're now going to move quickly to a second round. We only have about 5 minutes. I ask that you limit questions on other topics to no more than 2. And let's go back to Chad Perdelli of 6ABC.
Yeah, this question is for the mayor. This is from a colleague. She wanted to get your perspective on federal agents possibly responding to Chicago and Portland.
Well, we're opposed to that action. I mean, if the Trump administration wanted to help cities, they would have gotten off their rear ends back in March and April and helped us with PPE and with testing and with contact tracing. This is a game he's playing to divert attention away from the many crises that are facing this nation, and we'll oppose it with everything we have.
Thanks, guys.
All right, thank you, Chad, and let's go back quickly to Pat Loeb of KYW.
Mayor, have you met with the organizers of the encampment yet? And considering the heat, you have? Okay.
Yes.
And is there a resolution? Not
at the moment, but we're working towards one. Kelvin Jeremiah and myself, along with staff from the city, met with the organizers of what I would call more a protest as much as an encampment. So protests have kind of a different standard response. We've worked through some issues or been exposed to some issues they're concerned about. We're developing a plan now on the early action items that we can accomplish and having continued dialogue with them on the longer term resolution. Obviously, there's lots of people who are suffering with homelessness or partial homelessness, and we have responsibility to try to help that situation improve. And we're at least in a very positive conversational mode. I recognize the inconvenience to the community that lives around there. We're doing our best to contain that and to work through an amicable resolution that makes people's lives better.
And just the conditions of the people in the encampment, given the heat, is it a safe place?
We're available to get people into shelter, get people into safe places to be. If we've done I think we've placed about 40 people so far in a safer environment than being in a tent in the heat in the parkway. And anyone there who wants our help, we're there to help while we work through the policy issues relative to their being there in the first place.
Thank you very much.
Thank you, Pat. Let's go quickly to Sean Walsh of the Inquirer.
Thanks. I was going to ask about the same thing. Mayor, can you provide any other details on that meeting, where and when it was? And
same issue. Its location's not important. It was yesterday, and I've committed to meeting in the future. I think it's housing insufficiency in this city is a valid and critical issue, and if we want everyone to have equity in their lives, then we got to try to help address this issue. So I consider this a ongoing working relationship, and hopefully good will come out of it.
When do you think that it may be resolved in the encampment?
Don't know.
Okay. Thank you.
All right. Thank you, Sean. And finally today, back to Manny Smith of CBS.
Hey, I know they asked you a little bit about President Trump, but while we were in the presser, he kind of released some new information. The president signing an order basically restricting the count of illegal immigrants in the census. Any response to that, Mayor?
Who are you asking, me?
Yes.
I mean, this is a constant game he plays every day with a new item or new issue to appeal to his rabid base. I mean, it's got nothing to do with the betterment of this country. It's got nothing to do with addressing problems currently facing this country. It's more ability. It's more of his ability to divide or attempt to divide the country for his own political benefit, which I believe will not be helpful to him in the end.
All right. Thank you so much.
Thank you, Manny. And Manny, I'll add, I know that the Law Department and the Office of Immigrant Affairs are reviewing that latest development that just came out. So if you shoot us an email, if we have anything further on that, we'll let you know. But for now, that is it. That concludes today's daily briefing. We will be back on Thursday at 1 p.m. And thanks for joining.